I can say that Akuzia is the true example of mission value and compassion because she's always ready on the floor to help anybody, regardless of her busy schedule as a manager.
One of the residents comes out every time in the nurses station, asks for her husband. Akuzia is always there to help her and listens to her every time.
This is their home, and us coming in, we are the visitors in their home. So you're able to show empathy for the residents and make sure that you're not giving them sympathy, but you're really showing compassion through your daily work.
Last Christmas here, we had a patient who had one final wish, and that was to go and see the Christmas lights around town. So Amy managed to get it set up that she was able to get on the bus and she was going to go and she was going to see all the lights.
Her family were so grateful that we took the time to listen to her, and we did everything that we could to give her that opportunity one last time. I always try and put myself in their shoes, picture it as my loved one that was dying, ultimately with the most dignity that we possibly could.
Debbie is part of our care team in the laundry area. She always seems to be the one that goes that extra step. How she encourages a home feel environment, especially for our long-term care residents. One of the residents had in this heritage family quilt, and it was starting to show some wear and tear. And Debbie had taken it home, and in her spare time, she updated all the stitching and she repaired it, and she brought it back to them and presented it to the resident. And the joy was pretty amazing.
I've had the pleasure of having Mike King on my team for 4 years. I've had numerous opportunities to witness her demonstrating our mission and our values.
We laugh together, we talk together, we laugh. That makes me feel good as a resident here at the General Hospital.
It just comes from my heart and inspire them to improve their life and motivation to get them along with each other. It's my pleasure to work with the residents.
One of the times that I saw true compassion come through was one of our patients, his greatest need and his greatest want was to be able to sing again. Our SLP who was on that day had brought her guitar to work. Shannon started him singing the song, but then she slowly just dropped off her voice and he carried on. And what I saw that day was a great gift.
Patients are huge role models for us because they really show a lot about facing challenges with grace and optimism, and so it sort of draws you in to want to work with them as a person.
Lily shows compassion every day she's here. I remember one day one of the units called down and asked if someone could take a patient for a walk. And Lily was right there saying, "Can I do it? Can I go?" So she went up and actually made friends with the patient. The next day she was here, she went up without being asked. And every day after, when she was here, she would go up until that patient was discharged.
Compassion on my daily work because you're meeting all kinds of people and you want to be helpful, putting cheer on their face.
Lori demonstrates compassion every day that she's there, from the moments of touch to the way she talks to the families who are struggling with their loved one's journey, whether it be through dementia or complex health issues. Compassion is essential to the work that she does. What Lori does with compassion has a tremendous impact on the residents in her care. As you watch their face light up and a smile come upon their face, and she reaches out to touch their hand, you know that in those moments she has made a real connection with those residents and helps to make their day just that much brighter and better.
Lynn is a compassionate person. She's been so supportive of us. She lives compassion. The biggest thing for us was one of our colleagues had been diagnosed with cancer, and Lynn was there to help us normalize some of the feelings that we were having. She also did a workshop, an end-of-life workshop with us.
I think compassion for me is it's listening with my heart instead of listening with my ears to the underlying feelings and emotions that my patients have in their experiences and their life story.
My husband has got liver disease. Sangeeta will come in and she just is so calm and so understanding and supportive of him. She holds his hand, she's very affectionate with everybody. She calls him Papa Jim. She's very concerned about everything. I heard and report this happened, that happened. You know, she just listens to him and focuses on him. And she'll speak slowly enough that he can get it, and he'll answer and he feels respected and validated.